Okay, today we'll start our first section, Medical English Part 1. Like I promised last time, I will try to show you a lot of pictures so I don't lose you. Okay, if there's a question, you can just raise your hand. I will answer. I will slow down. Okay. My name is Dr. Anthony, and this is my website. It actually means Your Educational Podcast and Video. It's just a short abbreviation for the website. Because if I type it out too long, a lot of people will make a mistake and they won't find the website. And that's your hospital. Okay? Daegu Hani Hospital. Okay? That's me. One of my students at this university drew it. I think he's an art therapy major. But he's very good, and it actually does looks like a lot like me. Same hairstyle, and I like to wear red ties, so that's why I have a lot of red ties, and he remembered my red tie. And I will probably be using this. I told him I would be using this for my book later. I will be publishing a book this year, and I'll use it maybe I'll use it as a logo. It would be a nice idea. Okay, how to communicate with a foreign patient, which is initially is what this class is about. This is what we want to do. We want to learn how to ask the right questions. Same if you were speaking in your native tongue. Same similar questions, but we just want to be sure that we're properly saying the correct terms so that we don't confuse your patient. Okay? How to develop a set of questions for each case. Each case is different. Sometimes you don't have to ask all the questions, all the same questions of every patient. You don't have to spend that much time on each patient if, for instance, if their major complaint or their problem is very simple, straightforward, you can eliminate a lot of questions. You don't have to go into too much detail. But as each case gets more complicated, you have to ask more questions to be sure. We'll use our textbook as a reference guide, and we'll learn the common meanings of some medical terms. This way, when you become a doctor and you call me up and you ask me, we want to discuss your case, you can use medical terms. We can talk like doctors. Yeah? We don't talk the same as we do to patients, right? Patients don't understand doctor terminology, right? So we can't not speak to them in that term. So that's why we need to learn how to speak both ways. One for the patient, and the other way when we're talking to another doctor. So initially, when the patient comes in, we say, welcome to my clinic. Welcome to Daegu Hani Hospital. Welcome to Gangnam Hospital. Or in this case, I have Aju Medical Hospital. Actually, it's called Aju University Hospital. You say Aju Dehakyo Pyeongwan, right? I really like that hospital. I mean, the reason why I like the hospital because they're already established an international clinic. So if you are a foreign patient or someone who only speaks English for this example, you can go directly to the international clinic inside their hospital. You cannot get lost. They will take you by the hand and go through each step by step. They'll find you a doctor who can speak English and communicate with you. Of course, they have a lot of doctors in their hospital. Some doctors are better at communicating in English than others. And many of them like to have foreign patients. They enjoy it. So, Ajo University is an example that we should follow. Always come across very friendly and smiling. You know, in many hospitals, the nurses get together in the morning and they line up. First thing in the morning, they say, "Good morning, hello." They'll bow, and then smile, smile, smile. They'll say that a couple of times because they want all the nurses to get in a good humor, in a good mood, because they know they're going to be seeing people all day long who have problems. And the job of the nurse is to coordinate the easy entrance and exit of a patient, but also at the same time make them feel at home, make them feel that this is not a strange setting. The hospital is a friendly place. You know, many people don't like to go to the doctor. They're afraid. They don't like going to the hospital. They feel strange at the hospital. They associate sometimes the hospital with bad memories when they were a small baby. And their mom and dad was dragging them and they had to go get the injection. They didn't like that. So those are the kind of memories they have. What we want to do is change those memories. We want to replace those bad memories with good memories and good experiences, so they become a good patient. By becoming a good patient, we mean someone who cares about their health like we care about our health. Okay? So you can live a nice long life. There's no reason why we should not live to be 100 now. In the old days, we couldn't live that long. But now we have an opportunity to expand our lives because technology has helped us. We can foresee problems down the future. We can prevent somebody from dying of something very simple, something that's curable now. Okay? We can do that now. I would like to live to 100. Yeah, believe it or not, my grandma, right now my father, he's, I hate to say it, but I think I don't want to get it wrong because he might get upset if I say it wrong. 73, I think he's 73 now. And I believe my grandfather may have passed away when he was 87. And my great-great-grandfather, or perhaps great-grandfather, he died when he was 99. He had a good life. I need to beat that record. I'm going to hit 100. We need to ask first, after we say hello, welcome to my clinic, have a seat here, please. I would like to talk to you, ask you some questions. What seems to be the problem? There's a typo there. There should be an S there in front of seem. It's what seems to be the problem. What brings you here today? And let me begin by asking you what's wrong. These are all similar questions. You don't have to memorize them all. You can just pick the one that you like the best and practice and use it. Memorize it. Make your script, put your script together. Put one together, memorize it, and then later you can make little changes as you get better at asking questions. Okay? These are all All these examples are in the book. So don't worry about what you see on the slide. You can make little notes in your book to help you remember about the class, but all these examples are in your book. In fact, there are more than enough examples in that book, because in this book, they repeat it over and over and over and over again, which is good because you need to hear it over and over and over again to become good at it.